Urgent colon cancer symptoms: what your body is telling you. Essential signs of colon cancer that cannot be overlooked: a vital health issue that demands attention. The incidence of cancer, especially colon cancer, is not only rising among the elderly but is also becoming increasingly common among younger individuals. Let's delve into the reasons behind this alarming trend and initiate a meaningful discussion. Ensure you stay tuned till the end, as we will enumerate the most prevalent symptoms of colon cancer you might be encountering. Colon cancer stands as one of the most grievous illnesses today, ranking third in terms of diagnosis rate and second as a leading cause of cancer-related deaths. The battle against this disease is further complicated by the emergence of a vast industry surrounding it, an industry fueled by profits, deceptive advertising, and a deluge of confusing information that leaves both patients and healthcare providers perplexed and often mistaken. A widespread misconception is that the risk of colon cancer is predominantly determined by genetic factors. Indeed, having a family history can increase one's risk, accounting for 5 to 10% of cases, but this does not paint the entire picture. Genes may set the stage, but it is our lifestyle choices that ultimately play the pivotal role. Contemporary studies are progressively shedding light on the significance of diet and lifestyle as critical components in the prevention or even reversal of diseases. Foods abundant in antioxidants, for example, are recognized for their efficacy in combating various chronic ailments. This understanding is not based on conjecture but is supported by a rapidly expanding body of scientific research, indicating the direction future medical practices are likely to take. Identifying the presence of colon cancer, understanding its early indicators, and recognizing symptoms that signify advanced stages are crucial for timely intervention. Early detection is key to effective treatment. A colonoscopy, a diagnostic procedure that allows for the examination of the inner lining of the colon and rectum, plays a pivotal role in this process. It's essential to know who is most at risk and should consider undergoing this procedure. How do we tackle intestinal polyps to stop them from evolving into cancer, and are there natural strategies for their prevention and treatment? Contrary to common belief, this cancer variant can remain undetected for extended periods, often years. It usually begins as a benign, gradually enlarging polyp on the lining of the intestines. In its initial stages, this growth is small and does not disrupt the intestinal processes, leading to a lack of symptoms early on. This is why individuals, particularly those aged over 45 to 50 or those with a family history of cancer, are encouraged to get a colonoscopy for early detection. A colonoscopy allows for the visualization, identification, and removal of these polyps before they can develop further. The manifestation of symptoms is typically influenced by the polyp size and its location within the intestine. Notably, polyps that form on the right side of the intestine might be harder to detect due to the liquid state of feces in this area, making it challenging for even advanced tumors to cause obstruction. Thus, detecting a tumor early can be tricky unless it has progressed significantly or spread to other parts of the body like the liver, bones, or lungs. A crucial tip for early detection is to note that tumors may cause bleeding, but this bleeding is often not visible to the naked eye. An effective strategy for early cancer detection is to test fecal matter for occult blood. This involves collecting a stool sample and having it analyzed in a laboratory. Colonoscopies stand out as a crucial method for early detection. However, there are specific signs to be vigilant about, such as ongoing bleeding leading to iron deficiency anemia, particularly if you're around the age of 45 or 50 and exhibit a notably paler complexion than usual. If these symptoms are present, it's advisable to undergo evaluation for a potential intestinal tumor. In some cases, stools may turn darker due to more significant bleeding. Focusing on colon cancer located on the left side of the intestine, it's important to note that blockages or intestinal occlusions tend to occur more quickly due to the solid state of feces, resulting from less water content compared to the right side. What symptoms could be experienced? Before delving into specific symptoms of colon cancer, remember to follow our channel and turn on notifications for the latest health insights. A notable symptom includes a shift in bowel movements. For instance, if your regular pattern changes from daily or every 2 or 3 days to experiencing constipation or not having movements for a week or 2, it's a red flag. Additionally, the stool shape may alter, becoming narrower as it navigates through the affected section of the intestine, or you might notice alternating episodes of diarrhea and constipation. Persistent diarrhea could lead to a recommendation for a colonoscopy to investigate the possibility of an intestinal tumor. In advanced stages, the tumor may create a distinctive apple core appearance on X-rays, indicative of the intestinal lumens narrowing due to the tumor. This narrowing challenges the passage of feces and can lead to visible bleeding, often bright red, contrasting with the hidden bleeding seen in earlier stages. Stools might also turn darker from blood, similar to instances of right-sided colon cancer. Advanced cancer symptoms can include abdominal pain due to gas trapped by obstructions, bloating, weight loss, fatigue, and persistent tiredness, with potential liver pain from metastasis or breathing difficulties if the lungs are involved. Hence, understanding early detection methods and, importantly, natural prevention methods is essential. Intestinal polyps, often benign and symptom-free, dangle from the intestinal wall. Colonoscopy is the most effective means of detection, allowing for both visualization and removal of polyps for laboratory analysis to ascertain their nature. Yet, a small fraction of these benign growths may evolve into cancer over time, underscoring the critical message of this discussion. What drives the shift from a harmless polyp to a malignant tumor? As we've established from the start, it's the interplay between our genetic predispositions and our lifestyle practices. Contrary to erstwhile assumptions, our genetic code is not immutable. Indeed, it's possible to mitigate the risk of developing intestinal cancer through our choices. Research now indicates that our dietary habits, from how we select our groceries to how we cook them, are paramount in determining our health outcomes. Eating a well-rounded diet and adopting wholesome lifestyle routines can positively affect gene activity. In particular, genes linked to chronic inflammation, dementia, obesity, cardiovascular diseases, and cancer may become less expressive if we opt for healthier living standards. Conversely, suboptimal dietary habits and sedentary lifestyles can boost the activation of these genes. Put simply, such choices could expedite a polyp's growth and its progression into cancer. Factors that heighten colon cancer risk and hasten a polyp's malignant transformation include the consumption of ultra-processed foods, high intake of red meat and processed variants like sausages and ham, unhealthy fats, excessive use of vegetable oils, with the exception of olive oil, sugars, and high sodium levels. These elements, especially when stemming from ultra-processed products, significantly contribute to tumor development. The carcinogenic nature of ultra-processed foods has been recognized for some time. Other factors that play a role include constipation, suboptimal gut flora, and persistent inflammation. Moreover, lifestyle choices such as drinking alcohol and smoking have been identified as carcinogenic factors. Strategies for colon cancer prevention involve adhering to a diet abundant in anti-inflammatory and antioxidant-rich foods, including a diverse range of fruits and vegetables, spices like turmeric for their anti-inflammatory and antioxidant properties, and healthy fats found in certain fish and plant-based sources like chia and flax seeds. Avocados and eggs from free-range chickens are also beneficial for their healthy fats. Combating constipation, a risk factor for cancer, involves adequate intake of water and fiber, enhancing gut health while fostering beneficial gut bacteria. Moreover, undervalued aspects of a healthy lifestyle, such as sufficient sleep, regular exercise, and maintaining social ties, contribute to reduced inflammation and oxidative stress. Incorporating nuts and seeds, such as pumpkin seeds, into the diet can further support intestinal wellness. Let's delve into the subjects of diverticula and diverticulitis. Many individuals with these conditions often question whether it's safe to eat seeds, nuts, and the tough exteriors of some seeds and nuts. The answer, surprisingly, is affirmative. Despite widespread misconceptions, an extensive study involving over 47,000 participants has shown that the consumption of these foods does not escalate the risk of developing diverticulitis or its associated complications, such as bleeding. Therefore, the advice for diverticulitis patients to exclude these foods from their diet has been updated. In fact, such dietary choices may enhance gut flora and functionality and could potentially aid in the prevention of colon cancer. Nonetheless, it's crucial to approach each situation on a case-by-case basis. Thus, if you're experiencing any gastrointestinal concerns, it's wise to seek professional medical advice. Moving on to colonoscopies, what exactly is this procedure, and who needs to consider getting one? A colonoscopy is a preventative medical examination aimed at the early detection of colon cancer. It involves the insertion of a flexible tube with a camera on its end into the intestine via the anus, allowing for a thorough inspection of the intestine for any irregularities, including polyps, tumors, or other lesions. Should any polyps be identified during the procedure, they are removed and analyzed in a lab to determine their nature, benign or malignant. To ensure comfort, the procedure is conducted under sedation or light anesthesia, making it pain-free and often unmemorable for most patients. It's typically recommended that individuals begin receiving colonoscopies starting from the age of 45 to 50. Those with a familial history of cancer may need to start these screenings sooner. The advised interval between screenings is every 10 years, barring specific recommendations from your healthcare provider. While colonoscopies are safe, they do carry minor risks, such as potential bleeding or damage to the intestinal wall, though these complications are rare, occurring in only about 1 or 2 per 1,000 cases. We hope this information proves beneficial. Stay tuned for more useful health information. Don't forget to like and subscribe to update the latest videos. Thanks for watching.